I'm an academic GP, which means that as well as working as a general practitioner, which many people will be familiar with, I spend most of my work doing scientific research. The kind of research that we do is in the day-to-day problems that affect general practitioners. In my case, I'm particularly interested in heart disease and stroke and the prevention of heart disease and stroke. And one of my key areas of research is in the treatment of high blood pressure. Heart disease and stroke are the biggest both cause of serious illness and cause of death in both the UK and internationally, and stroke in particular is the leading cause of disability. If you have a stroke, many people will know from their friends and relatives that it's a life-changing experience and can be devastating. So what we've discovered in our research is that blood pressure varies a lot from time to time. Many people will be familiar with that experience of going and seeing the doctor and having a thing on their arm pumped up and making them feel slightly anxious. And we know that one-off measurements of blood pressure in a general practice or in a hospital are often much higher than blood pressure on a day-to-day basis. So what we're doing now is studies where we get people to measure their own blood pressure and then adjust their own medication. Now, we don't expect them to do this on their own. We think that the relationship between the patient and their doctor is very important. So at the beginning of the study, the patient meets with their doctor and makes a plan as to what they're going to do if their blood pressure remains high. And what we found doing that in a group of around 500 patients with high blood pressure is that those measuring their own blood pressure and adjusting their own medication ended up with lower blood pressure, significantly lower blood pressure, to the extent that you might expect a reduction in their risk of stroke of about 20% and of heart disease of about 10%. We think that the impact of our work is very important on both the health and the wealth of the nation. In terms of health, we know that reducing blood pressure will reduce strokes and heart attacks, which are major causes of death and disability. And in terms of wealth, we know people with high blood pressure see their GP perhaps 4 times a year on average. In England alone, there are 7 million people with high blood pressure, so you can imagine that's an awful lot of consultations that are taken up with blood pressure measurement, talking about blood pressure.